Well, it's great to be here at ASH in sunny Orlando. My name is Jonathan Peled. I'm an assistant attending in the adult bone marrow transplantation service at Memorial Sloan Kettering Cancer Center. One of the things that we're discussing here in the hallways and in the conference rooms at ASH is the health of the microbiome and how that might be harnessed to have an impact on the health of patients who are receiving bone marrow transplants. Allogeneic bone marrow transplant is a curative therapy for leukemia and lymphoma, but graft-versus-host disease is a lethal complication. Up to 50% of patients who get transplanted can suffer from GvHD, and a sizable fraction of those go on to die of that complication. And there are a lot of lines of evidence from our group and others that the health of the intestinal microbiome may have a strong impact on GvHD. So some ways that we could think about improving the health of the microbiome could be to make judicious use of antibiotics. So for example, we have an ongoing randomized trial at our center where we're randomizing patients who get fever and neutropenia during their transplant course to either Zosyn as an antibiotic or cefepime. And that choice is critical, we think, because Zosyn kills anaerobic bacteria while cefepime spares them. And while that's not critical, whether you do that or not is not a critical decision to protect a patient from a bloodstream infection, but it might be critical for GvHD because we have laboratory evidence and observational evidence from human studies that the anaerobes are important for gut health and for GvHD prevention. So the hope of this trial is that the anaerobe sparing option, the cefepime arm, will do better and have less GvHD. There are other approaches perhaps as well, such as prebiotics, which would be a food type that might promote the growth of a healthy bacterium or prevent the outgrowth of a non-healthy bacterium. You could also think about postbiotics, which would be the metabolites that bacteria produce that might then modulate host physiology. Perhaps we could just administer the postbiotic, the metabolite, if we could just sort out which are the right ones to give. And of course, there's the probiotic approach, which might be a fecal microbiome transplant, such as is used for Clostridium difficile infection, or probiotics, perhaps even rationally designed ones. So those are some of the approaches that we're exploring in the lab and in clinical trials to try to improve the health of the gut microbiome in transplant recipients, all with the ultimate goal of preventing graft-versus-host disease.